foreigners, we tend to have harder time getting preceptors, and so a lot of them we are missing their semester, missing their graduation period because of. So when I opened my practice, I opened it up to them, So I was taking, I am taking Americans, both African Americans, white, but I laid more emphasis on foreigners, whether it's Nigerian, Cameroon, Ghana, just for them to have an opportunity.
Hello, everyone. Welcome back to Indie Speaks TV. We are here on another yet amazing nursing story, and I have someone that is so amazing, so awesome, means a lot to me. At one point, was my primary care provider. We go way back. So, Dr. Nikki, she's gonna introduce herself, and then we're gonna get right into the story for today. So, Dr. Nikki, welcome and thank you so much for this opportunity. So you can just introduce yourself, and then we'll go on.
Thank you so much, Andy. It's wonderful to see you. It's been some time now, so because when we get into practice, we get so busy. My name is Dr. Nikki Ezeani. I'm from Nigeria, as I'm sure you've assumed, and yeah, I'm here. I'm the medical director of Lomack Primary Care. It's a nurse practitioner, a neighborhood nurse practitioner clinic that I started 2011, late 2011, and I'm still here. The practice is getting bigger, and that's what I do full time.
All right. Thank you so much. Oh my God, 2011. I can't believe it's been that long. God is
Mm-hmm,
good.
mm-hmm.
All right. So, Dr. Nikki, you hold a doctor in nursing practice. Can you just tell us about your nursing journey, like where you started from? Did you start as a nursing assistant? How was your journey to where you are right now? Because that's awesome.
Yeah. Um, my nursing journey started. Actually, I left Nigeria late 92. Uh, I came with invitation from my husband. So I was first year, doing my master's at University of Nigeria. So I got here and trying to, get into school system, everything they needed because of the transcript. It seems like I still have to go back to school, to do something. And being married, and before I knew it, I was pregnant. I was looking for something else to do. And yes, my psychology, I looked at what is closest to it, and it's nursing. And also from people before me who gave me advice on, you are now a wife, you be a mother, you need to do something that is flexible and a career that will help you, to catch up on time. So, and when you consider psychology and nursing, that the same thing, and it helped me with my transcript when they converted it, I was able to get enough hours. But then I needed something. I'm somebody like that I don't like to sit one place. I needed something to do right away. So I went down and did a nursing assistant. I picked up from there. I did nursing assistant program from Prince George's Community College. I got that. While I was finishing that, I found out about a school in DC, Martha, Washington, for LPN, licensed practical nurse. So I went there and I did entrance exam and I passed. So I did my exam for the nursing assistant. I got that certificate, license, and but I didn't work with it right away because I went straight to the licensed practical nursing. I did that for 1 year and then came out and took my board right away. It's not like now. Those time was paper and pen. It
Ah,
wasn't computer. So, and after you do your exam, it takes about a month and a month and a half to get the result in the mail. So while I was waiting, so I got a job as a nursing assistant. So I was working as a nursing assistant when I got my result that I passed for the LPN. So the same job retained me and trained me as a nurse.
Oh,
So
wow.
I worked there, and after 3 years, I went back to Prince George's College and started my prerequisite um, for the RN,
Right.
registered nursing. So he made me to work night shift for a long time because I did that and I started. When I finished the prerequisite, I went into University of Maryland and got my BSN. So when I got that, by then I've been with the BSN. I was promoted to director of nursing,
Oh,
and I
wow.
did that a little bit. And I knew that as a registered nurse, you know, I need more. I need to have an acute experience. So I transitioned to the hospital in my community, and I went to the ICU. Even though I went different, I did ICU, I did open heart, I did emergency room, neuro ICU. So I did that for a little over 5 years. And I decided it's time to go higher because, something about profession is that, you stay, you look at others and, so I went back to school. I went back to University of Maryland and I registered for the nurse practitioner. It wasn't,
Mm.
when you look at how many years nurse practitioner has been, still it wasn't a lot of nurses we are nurse practitioners.
Yeah.
At the time it was difficult because I didn't get the support I thought I would have. My friends and colleagues were telling me why, what we are doing now, is more than the salary for nurse practitioners. Why?
Mhm.
So it was a lot of challenges at the time, but I made up my mind, so I went. So I did that, and but it took me because I couldn't do that with family with ICU. So I had to leave the hospital and go to the skilled nursing facility as a supervisor. So I will have time to do that. So I did that. I got my nurse practitioner 2005. And right there at the facility, the medical director of the facility hired me right
Ah,
there. Yeah.
Dr. Nikki, you're lucky. Oh.
Yes, right there. So the facility did my send off, as their supervisor on a Sunday. The next day, Monday, I came back to the same facility
As the nurse
as the
practitioner.
nurse
Oh
practitioner.
my
Yes.
God.
And because he was a solo practice, it was a little tough because there was no time for him to, you know, do orientation or even, do anything. I got to the facility, and the good thing is it's a facility I've been a supervisor. So I
Mm-hmm.
know the staff, I know the patients,
Excellent.
So I was just calling him in things I'm not sure of, and that's how I built myself up. And
Wow.
he was doing a lot of nursing homes, and then we have one office, outpatient office. So I worked with him until we grew. We were able to add 4 doctors to make him
Oh,
five
wow.
doctors, 4 nurse practitioners to add to me as the fifth. So we became 10 provider practice in Rockville. Yeah. So I spent 6 years, 5 or 6 years with him there. I so many things. I give him. Up till now. I give him that credit. He took his time at the time I was only the provider with him. He trained me really well. He didn't spare anything. So I got so strong that at this time, 5 years, I felt there's nothing I could not do. And I got this, I couldn't have immediately thought of opening a practice, but there was a church, you know, an African church in 𝐥𝐢𝐤𝐤 that needed a provider to help their congregation. Those who have diabetes, high blood pressure, but they don't have doctors. Somebody to refill their medication, run a little lab. So they gave me a room, in their church, so I can be coming a day or two to do that. So I did that and I got the hang of it. I liked it. I can see them, I can check them out. I'll draw their blood and run it to the lab. So as I got used to that, that was early 2011. So by October, November of that 2011, I felt confident that by then Maryland hasn't even received the full authority, but I felt I can do this. So I got my first office and I started marketing, talking to friends who were bringing their mothers, their father, people from home out of pocket,
Wow.
marketing through the nursing assistant schools and home health schools for their physical.
Wow.
And then slowly I credentialed, So not till late 2015 before Maryland got the full, authority. But, so that's how, but then you talked about the doctorate. Yeah, I was practicing. I didn't have any problem, you know, covering my limit. But then my patients will come, that used to, see me as a doctor, Dr. Nikki, Dr. Nikki. I felt like I'm not supposed to call myself a
Yeah.
doctor. They can call me what they want to call me, but when I call them on the phone, I can't say this is Dr. Nikki, So I felt it's time I need to get my doctorate so that, it can balance out. So I went back to school and got my DMP. That was 2016.
Wow.
So since then, I've been practicing till today.
Wow.
Yeah,
Amazing, amazing.
that's
I'm
my
going to
journey.
take you back just a little bit. When
Uh,
you went back to school for your RN, in comparison to Nigeria, how was
mm.
that experience when you went?
Yeah, the experience is different. Why different is because, when you talk about Nigeria, remember, Nigeria doesn't have, nurses doesn't have authority, you know. And I can give credit to midwife, the midwifery, because they are the only nursing that had that independent, because they can deliver babies, and do all that. The only thing they will not do is C-section. But here in nursing, we do more, We are taught so much, it was amazing how much knowledge that you get as a nurse and what you can do independently. Yes, we report to to doctors, but the education is different.
Yeah.
Yes, it's different.
All right. So you are the former president of the National Association of Nigerian Nurse Practitioners. Can you tell us about a little bit about the association, what they do, and how did it all start? What is it all about?
Actually, I'm still.
See?
Mhm. Yes, I'm
Okay.
still. So,
You didn't correct me when I said before you're the former, you did not correct me. Okay.
so when I started practicing 2005, um, University of Maryland gives you a year or two for you to get strong before you can precept their student. But right after I started working, and I told my instructor that I'm working, boom, I got my first student. So I
Wow.
started precepting from 2005. And my employer at the time, like I told you, very nice man, he allowed me the opportunity to precept. So then when I started my own clinic, I know that, when I say this, it's not like there is any difference or racial thing, but the fact that, foreigners, we tend to have harder time getting preceptors, and so a lot of them were missing their semester, missing their graduation period because of. So when I opened my practice, I opened it up to them, So I was taking, yeah, I'm taking Americans, both African Americans, white, but I laid more emphasis on foreigners, whether it's Nigerian, Cameroon, Ghana, just for them to have an opportunity this time. You went through me.
Yes.
Yeah.
Yes.
So sometimes I even discomfort myself because as a solo practice, sometimes I have 6 students,
I know.
5 students. I try my best just not allow them to miss their semester of graduation. So when I noticed all these problems, and if anyone I couldn't accept, it's like a personal thing. I feel bad, what is going to happen to the person. So with that in mind, I started thinking in the way of how do I bring other MPs to help out? Why am I the only person around this area precepting? So that's when I thought about bringing nurse practitioners together, in as an organization, but then it will be so overwhelming if I say Nurse Practitioner Association. We already have the Maryland, the MPAN, Nurse Practitioner of Maryland, so, and I can't say African. How can, it's too much for me. So I need to narrow down. So that's how I started the Nigerian Nurse Practitioner Association in 2017. I called all the nurse practitioners I know that are already licensed, and even the ones that are in school, to let them know that let's come together. Let's form this association so that we can help each other out. So that's what happened. So as we have the seasoned nurse practitioners and then the student one, so we started precepting the students. So, that's how, we, until 2019, that's when we inaugurated it. We inaugurated the association here in Maryland, and we started growing. Anybody that hears, whether students or MPs, they will join. And as at the time that 2017 we registered it, we had 3 DMPs in there. Now we have 21 DMPs in the association. Then we have students. Most of the members were students. Now we have over 60 something, nurse practitioners who were students then. And then the rest are the ones that were nurse practitioners and joined. So we grow each time, and later that 2017, I heard about, somebody told me about a nurse practitioner association in Dallas. So I called, the person gave me the number, I called, and I was able to speak with their president, Dr. Linda 𝐦𝐨𝐬. I spoke with her, we talked about, she was so excited, she thought their own were, they were few months before our own. She never knew there's anywhere else. We were answering Nigerian nurse, but they were answering national, something else, And so when we came together and we said, we can, put this together. So we put it together, and that's how we came up with the National Association of Nigerian Nurse Practitioners. She's the founder and president of the Dallas. I'm DMV. And then that's how we grew. Now we have 10 chapters in different states. Yeah. So that's how big we've been. So now we have, in October 6 to 8, we are having our national conference here in Maryland.
So people from different states are coming, all coming to Maryland.
They're all coming to Maryland, in Lincoln, Maryland. Yes.
Wow. Oh my goodness, that's amazing. So, Dr. Nikki, before I even ask you to advise other people that are thinking of becoming nurse practitioners or nurses, so tell us a little bit about your clinic, your Lomack Primary Care. Where is it? And how can
Okay.
someone find you? All of that.
Okay, my clinic is in Silver Spring, White Oak Silver Spring in New Hampshire Avenue. It's called Lomack Primary Care. Lomack is my children coined out the name from their
Oh,
name. I
wow.
have 4 children, so they put the name together from their name.
Wow.
So I started the clinic, and I started small, just like any other business. I have a friend. We call each other partners. Um, by name, she won't mind if I call her name Dr. Stella Jeffries.
I know
We've
her.
been friends from the nursing home.
Oh,
So we shared the suite together. We even shared our first employee. And thanks to Obamacare, I'm telling you, when it came out, it was like an influx of patients
patient. Wow.
that the suite could no longer contain us. We even have patients sitting out in the hallway.
Oh,
So
wow.
we tried to find a place that is larger, but the building couldn't get that. So we ended up splitting. We're in the same level, fifth floor. So she is in 501, I'm in 507.
Wow.
So that's how big we've gotten. And in my clinic, I do, like I said, I was just seeing patient and doing nothing, still doing nursing home visit and dialysis center. These are the skills I picked along the way. But after some years, I figured out that I won't grow my clinic the way I want to grow if I keep moonlighting every other place, growing other people's business. Let me come here and see what I can do. So I told my family to tighten their belt, because things gotta change. So I started adding things. So I do DOT, like truck drivers,
Oh,
I'm a medical examiner. Then I do cannabis, certification. I
wow.
do IV infusion, both in regular normal saline infusion, or whether it's the vitamins, whether it's the skincare, I do that. I do weight management. I do. I have a vascular specialist that comes here every
Oh,
Friday to do ABI, arterial brachial index test
index.
to check
Yeah.
for PAD,
PVP.
PVD. Yes, yeah, and then I do diabetic neuropathy testing. So those are the things that when you bring them to the clinic. Yes, one patient you see, there might be two or three other little skills you might add to the billing, that brings it up. So, and then the only way, like I said at the beginning, I leave the office is if I have patients who are homebound, who cannot come to the office again, so I go to the homes to visit them.
Oh,
And
wow.
I have portable EKG, and I have my bag for the blood draw. I go there and see them and do whatever I need to do. If
Wow.
that coming from another provider, I will send the result to that provider to keep track of their progress until that they come back to see them. So now I'm scaling back a little from that because I just opened the home health agency.
Ah, ah,
So
ah.
I've gotten all my certification, even Medicaid waiver. So I'm beginning to send home health aid, nursing assistant nurses to the homes. Yeah, that's my retirement pathway. I can't eat by only the person I touch. If
Yeah.
I depend on that the only way I can eat is I have to touch a patient, I have to write the note, I have to bill it, I have to do it. How long will I survive? So at a point you have to find exit, pathway. So I'm looking at it as being my exit pathway so that if
And you
I
also
any
do
day
you
any
also
day I
do
don't
women
feel well, somebody will
mhm.
be walking out there for me.
Yeah. You also do women exams because I know you do PAPs.
Oh yeah, I do. Yes, I do pap smear for women.
Yeah.
I sometimes, I do some hormone therapy depending on what is going on. So, it's a nurse practitioner clinic. We are nurses. We do all. Once you do your training and do certification, you can do that.
I want to be
So,
like you when I
um,
grow
what
up.
I'm preparing now, I've been doing a lot of webinars for my association on, I did how to start a nurse practitioner clinic.
Ah,
I've done that, and I did how to maintain a successful nurse practitioner clinic. The one I'm going to do tomorrow, I have a webinar with them
I'm
tomorrow.
registered for that one.
Yeah, that one is effective documentation, and how you can document to avoid, to bill whatever number you, because your documentation depends on what you bill. You
Mm-hmm.
don't bill high and you give them a chicken scratch in the paper. You have to show exactly what you did. And also that will avoid from recoup, because whenever you're audited and they look at what you build is not meeting up with what is supposed to, they will take money back. And
Wow.
also I will teach them billing and coding for nurse practitioners, how to do that and be able to get a quicker payout. And so that will happen tomorrow. So why
Mm.
I brought it up is because I'm looking at people has been coming. Actually, I was reading to my manager. I got this mail from Athena Health. Athena Health is a EHR company.
Yeah.
Yeah, so people has been advising me, those who have listened said I need to start a webinar, like a class, a program,
Yeah.
where I can mentor, like a nurse
Mhm.
practitioner mentoring program, So that's what I'm trying now to put together,
You have
to
you
start
have
that.
a lot. You
Yeah.
have a lot to share.
So the lady wrote to me, "Good morning, Dr. Ezeani. I wanted to reach out to you because someone told me that you are helping nurse practitioners to open up their own independent practices.
Oh wow.
You are running training sessions on how they could proceed. This is so selfless of you. I have never heard of anyone doing what you are doing. I cannot express my awe and how inspiring you are to me. I wanted to
Oh,
reach out to you and connect with you. I want to hear your story and other stories, and I want to be involved somehow in helping along with you. I might be able to be resourceful in providing help to you. If there's anything I can do to help, please advise. I also want to send you something if you can give me a current address where I can do so.
oh
Please
wow.
let me know when you have some time to talk. I owe you a big thank you. Best." I
Oh.
just got the today. So that's why I'm trying to. I'm not someone, when you came here, I never charge students a dime
Nope.
to train. But
Nope.
I figured out that mentoring is not only, nothing is not different. It gives, every person that confidence to practice. If somebody who has that skill can mentor you on, it's not only when you have your practice, even when you work in any healthcare setting, so that you can understand. It's not easy to move from nursing to medical.
Nope.
We used to call doctors for every. Now we
Mm.
are the one,
Mm.
treating. Then who do you call? So that's why sometimes some MPs fail. Some still stay in their RN jobs.
Yeah.
There is some anxiety in doing this.
Mhm.
So so I thought about that. I said, I think I will do that. I will start to
Mhm.
mentor. Just put a little fee. Then I can mentor the people and get them to where they're confident to practice.
Yeah.
Yeah.
I have to say, me, I'm a testimony of that. Since the nursing home, I remember when I met you, I think I was still an LPN then
Yes.
on the
Yes.
floor. Then
Yes.
you became my doctor. Even when I did my BSN, I came to your clinic. I did
Yes.
my rotation there. When I did my FNP, I came there. I did
Yes.
anytime I called, just like now. I just sent a message, Dr. Nikki, please come and share your story. So I have to say, I completely understand that lady. I've never seen a selfless person, and I just I know that God is the one that is holding you, that is blessing you, because what I know for sure is that whenever you put something out of your heart and help people, God got your back no
Thank
matter
you.
what you do. That's why you're succeeding, and that's why you have favor and people love you, honestly,
Thank
because
you. Thank you so
God
much.
don't give
Mm,
out. I have to say that.
mm, yeah.
So for someone that is, a foreigner that is trying to make it here, thinking of going to school, or someone that wants to open their practice and thinking of, will I make it, will I survive it, should I do it,
Mhm.
should I not do it, what advice would you give to them?
Well, the advice I would give is the person have to know exactly what they want to do.
True.
Not because they always think that all foreigners, especially women, are nurses. Yeah, there are some who don't like nursing, and
Yeah.
those are the ones that don't succeed.
Yeah.
So before there are so many things. It depends on who you speak to, and if you actually went out there to look for information, you have to make sure you understand that this is what it is for me. And when you actually come into nursing, I've noticed that a lot of us take nursing for granted. That's why sometimes we think that Americans do better, than us. I don't think so. It's just for you to apply yourself. You know, when you get that training, get the best of that training, apply
Mm.
yourself to it. And when you walk as if there's somebody behind you. Do the best, learn it. Don't do cover up, don't cut corners, because one step takes you to the next one.
Yeah.
You know, even as I precept, I know, from there I know who is the what type of nurse whoever is. Because from how they pick up the skills, and what I have to teach, there are, as a nurse, I don't need to teach physical exam. You're supposed to have had that.
No. Yeah.
Yeah. The only thing I might add, if there's any other specialty test that you need to check for this, for that, but not the routine, general,
Basic.
physical. Yeah. But then you see them, and some would tell me, with confidence that, oh, I was an office nurse. No. Even my teachers in school when I was in Maryland, they were all working bedside somewhere, maybe one shift a week, or just to
To
retain their
maintain
skill.
their skill. Mm-hmm.
Nursing, medical, all these are what you have to retain skill. It doesn't just fall down. And once you lose it, you've lost it.
Yep.
If you think that you're going to move to another level, you gotta master the last level. Master it. That's what will edge you forward to be able to grab the next level. So the advice I give any person from, whether it's Africa, any country coming here and looking into nursing, because we are very good at telling people, oh, go into nursing. It's flexible. Go into nursing. You
That's
make
where the
money.
money is.
That's where the money is. There is overtime. There is that. No. There are some nurses in jail. There are some nurses that have lost their licenses. So it's not that easy. I'm just letting them know that that has to be, what you really want to do. And when you get into it, be the best you can be on that. It's a profession.
Yep.
Nursing is a profession. So, but sometimes we are relegated to the ground, back that as if this is not a profession, you know. So we are a very, very big profession, so you gotta treat it that way. Mm. So
Woo, thank you.
you're
Thank
welcome.
you, thank you, thank you, thank you so much.
You're
This was
welcome.
so,
You're
so,
welcome.
so, so awesome. Uh, to round it up, I just want you to say bye to everybody. Thank you so much for listening. We'll bring you back again for something
Ah,
else.
no problem. I would like to come. I would like to come. I'm happy. I'm happy for you. I'm really happy. Because if you remember back when we were at the nursing home, it was few of you there. If each time I see you, I say, "What are you still doing here?" I pushed you into BSN.
Yes.
Because yeah, I always tell you, Andy, you are beyond what you are doing. You need to get to the next level. So
Yes.
for you to be here, I will do my best. I will be here. I will support you in whatever you are doing.
Thank you so
And
much.
also for nurses out there, maybe one or two things I said today will touch them. So,
Yeah. Yeah.
we gotta
Oh,
lift it.
definitely.
We gotta lift our profession up. Yeah,
Definitely.
yeah.
All right, Dr. Nikki, thank you so much.
You're welcome.
God bless you.
You don't turn on me now.